for all of us team. You get to hear my voice, and many of them coming from Vanderbilt, many of them shout out to everyone who has been you all. So we'll just go ahead and third series in the file. Oh, okay. Thank you very much for letting me know the audio. I'll try to speak slowly then. Let's just go ahead and get started with the next slide. Again, welcome. This session is being recorded. The slides and the recording will be sent to everyone who has registered. Please use the Q&A option for questions. Questions will be answered when the presentations are complete. We will get to as many questions as possible, and please fill out the survey after today's presentation. For the Q&A button, you simply just want to go ahead and use the either view all questions on your own or submit a new question or comment on submitted questions, or use that thumbs up icon to upvote questions. Upvoting makes it easy for us to know what questions participants are most interested in hearing. We'll go with the next slide. Okay. Just a quick note about NIH research analytics services that are offered to you through the NIH library. We offer the bibliometric service for publication analysis to understand the impact of your research. There's also bioinformatics support, which provides solutions for retrieving and analyzing biological data. And then in data services, we offer data management, data visualization, analysis, statistical support, and coding and training. We also offer high-performing workstations. You can remote into those workstations and use those services there. We also offer several training classes. And if you have any questions about any of the services in research analytics, feel free to just go ahead and email me. My email is at the bottom of that screen, or you can visit us on the library website under services and data. We'll go to the next slide. Just as an example, here are a few classes that are offered by our research analytics team. Two upcoming classes are tips for getting started with SAS training and creating pivot tables in Excel, as well as many classes that will be offered in the month of May. So now that I've given you a quick overview of the library and our services, I'm very pleased to go ahead and introduce Dr. Michael Lyons, who will be our speaker today. Dr. Lyons is a scientific project manager for Vanderbilt University Medical Center, and he's a member of the outreach team at the All of Us Research Programs Data and Research Center. He received his PhD in microbiology and immunology from Stanford University, and he's interested in applying his scientific background and knowledge in a translational setting that will benefit patients. As part of All of Us, Dr. Lyons focuses on helping researchers utilize the program's diverse resources for their own research needs. And additionally, he develops beginner training materials aimed at broadening the audience of researchers able to engage with the All of Us data set and expand the impact the program can have on personalized healthcare. So without further ado, I will go ahead and turn it over to you, Dr. Lyons.
Yeah. Hi, everybody. I'm Michael. Thank you for that wonderful introduction, Cindy. And I'm really excited to be here and able to kind of take you through today's lesson plan. So the objective of today is to really learn how to start engaging with the All of Us data and kind of understand how to start a research project. So the three main objectives that we're going to go through today is learning how to explore the data that All of Us provides, how to create a workspace to begin a research project on the Researcher Workbench, which is our cloud computing platform, and then learn how to generate a cohort and data set of interest to begin analysis. kind of running through and running code and running that analysis will be covered in a future section. So we'll kind of do everything up to that point. So kind of to start off, we're going to start with how to kind of really start up a research project with all of us. So we're going to go into, again, kind of a recap of what is available, where is the data, how do I engage with it, and kind of how is it displayed for researchers. So as you can see here, there's 3 different labeled tiers that we have. So we have our public tier, our registered tier, and our control tier. So our registered tier and our control tier is where researchers will actually engage with row level data on the researcher workbench. But our public tier is where you can get information on what data is available within our research program. And while the data is very, very vast, it's not unlimited. So this is a great place to kind of test if your hypothesis, if we have that data that you're interested in exploring, and what you can really do with the data that we have. And then from there, registered researchers will be able to engage with that row level data in the registered tier or controlled tier on a researcher workbench. And that's where you'll actually work with that data and kind of a recap of what data types we have available. We have surveys, we have electronic health records, we have physical measurements, we have wearable Fitbit data. And then also in our control tier, we have some additional like more specific type of data, such as our genomic data. So whole genome sequences, array data, we have structural variant data, and also we have a small subset of long read whole genome sequences. And then also some additional things that are in the control tier versus registered tier is that in the control tier, you get the exact date of events, while in the registered tier, they're shifted within 1 year. So all this data together is really, you're going to be engaging with it either in the public or researchallofus.org data browser, or within the researcher workbench, which is our cloud computing platform. And we'll go over how to kind of engage with at both sections today. But first, what we're going to do is we're going to kind of build a potential research interest. So I'm going to present on a little story of kind of the link between one disease, another disease, and a gene that kind of ties them together. So the first disease it's called African sleeping sickness. And this is a disease caused by a parasite, Trypanosoma brucei, which you can see kind of that squiggly worm-looking thing in black and white. And this is endemic to sub-Saharan Africa and is basically fatal without treatment. And from this kind of this endemic sickness, 2 mutations within apolipoprotein L1 or ApoL1 kind of arose and gave some increased protection against African sleeping sickness. However, it's also seen that these mutations in ApoL1 have a higher frequency and are linked to chronic kidney disease or CKD. So we actually see genetic variation in ApoL1 accounts for 70% of chronic kidney disease among people who have Western and Central African ancestry. So there's this really interesting kind of play between infectious disease and genetic resistance to that, and kind of other genetic diseases like chronic kidney disease and how those can kind of play out. So if we're interested in kind of exploring this dynamic a little bit more by looking at the researcher work at what we have on the data in the research, all of us on the researcher workbench, we can kind of start building some sort of hypothesis and then engage with that data. So if we had a research interest of kind of recapitulating what has been seen previously and looking at what is the prevalence of ApoL1 mutations in all of us participants with chronic kidney disease, we can kind of have that as an interest. And if we want to expand that and look at other risk factors associated with chronic kidney disease, we can also look at other things beyond just the genetic data that's linked to these participants. We can look at electronic health records, what other conditions seem to be linked, if there's demographic factors, if there's things that come up in their surveys. So we can look at like all these different types of data that can potentially affect. So what we're going to do in our research strategy is we're going to first explore the data that is available within the researcher workbench. So we're going to go on that public site and see, okay, we're interested in chronic kidney disease. We're interested in ApoL1 gene mutations. What does the research, what was all of us provide in that terms? Like what do we have available to work with us? What are our accounts? And if that's suitable, then we'll go into the researcher workbench after we become a registered user, and we'll start developing our cohort and data set to actually start engaging in the analysis. And then finally, step 3, we'll boot up our app of choice, and we will run that analysis on our cloud computing platform, in either Jupyter, RStudio, or SAS, which is great. We're able to have all of those there now. So we used to only have Jupyter, but very recently we expanded to also support RStudio and SAS. So if there's any RStudio or SAS users, we got you. So we're going to focus on 1 and 2 today, and we will kind of dig into number 3 late at another time. So first, we'll go to exploring the public data browser. For this section, I'm actually going to go off of the slideshow, and we're going to go through it together. So I'm going to stop sharing my screen for a moment so I can pull up the actual website, and I'll share my screen again now. All right, so everyone should be able to see this. So this is our research hub. This is our public website. I believe that if you were here at previous sessions, there was kind of an overview of what this was, but I think it's very helpful to just go through together and see how to engage with this data. There is a lot of information beyond just what data is available here. Just to point out, so if you go kind of to this menu, you can find out a lot more about the program. So if you want to learn more about the program, but what we're really going to be focusing on is this data and tools. So if you go here, we have our data browser, and that's where you will see what data is available. But you can also see other things like our data snapshots. We'll have update counts on where our program is. As a reminder, our program is trying to get up to and beyond 1 million participants in size. So here you can see where we are. We're currently sitting around 750,000 registered participants, and we're still growing. And so if you're interested in that, you can also see that and kind of how things are organized and methods and what we ask in our surveys. You can also see all of that. But what we're going to stick on for today is our data browser. So we'll go to our data browser. And this is where you can search across all of our different data types. So we have our electronic health records domain. So you'll be able to search for specific conditions, drugs, lab measurements, etc. We have our genomics section. So you can search for specific mutations or genes that you're interested in. You can see our counts for physical measurements, our Fitbits, and then also all of our different surveys. So we have 8 different surveys here. And you can see how many participants have filled those out, and you can go into and look at the different questions there as well. But if you want to kind of find out in general, we have a great search bar. As you can see, I've recently looked up chronic kidney on the way to chronic kidney disease. So you can actually just type in keywords, and you will be able to see what pops up. So if we're interested in how many participants within the All of Us research program have chronic kidney disease, we can type that in. We're going to be looking for chronic kidney disease as a condition within the electronic health records. So we'll click on that, and we'll be able to see a really nice breakdown of the participants that have chronic kidney disease or have chronic kidney disease of some sort in their electronic health records. So you can see the bar, you just scroll over the bar, and you can see that we have 26,280 participants within the All of Us research program that have chronic kidney disease. These counts on the public site, they're all rounded to the nearest 20. And if they are less than 20, they will just say less than or equal to 20. But you can also see that there's further breakdown. This is kind of the larger count of chronic kidney disease in general, but there's also chronic kidney disease stage 3. So however it pops up in their electronic health records, you can see that. And so we know that we have a large portion of participants within our potential cohort that have chronic kidney disease. So that's fantastic. If you want additional information, you can also scroll down here. And you can get more overall kind of general statistics such as male versus female and other participant counts, age ranges, and you can actually see the source as well of where these came from. So the SNOMED codes, the OMOP codes, and that's how our data is organized for electronic health records. It's in the OMOP data dictionary. We standardize everything to SNOMED codes, but we take in, as you can see, ICD-10 codes, ITT-9 codes, SNOMED codes, and we just kind of sort that into SNOMED codes. We have a lot of support materials if you're not familiar with working with electronic health record data and working with the OMOP data dictionary. We have kind of background information on that on our support hub, which I'll kind of link into very briefly later, but I think we will have more presentations that go over our support materials at a later time. So that's fantastic. We know that we have a large participant population that has chronic kidney disease, which is of great interest to our research interest. So then we'll go back to the data browser, and another thing we can do is look at what APOL1 mutations are present as well within our participant population. So we have our electronic health records domains, and then we have our genomics. So we have a separate data browser just for looking at genomic data as well. So we have almost 250,000 participants that have genomic data linked that we can engage with. So we'll go to our SNP variant indel variant search. And so we can search for specific things by a number of different methods. So as you can see here, we can search by either gene, a specific variant of interest, as well as genomic region and location. So if we're interested specifically in APOL1, we can type in APOL1. And then we'll get all of the variants within our participant population that have linked genomic data pop up here. So as you can see, we have over 10,000 variants. So there's a huge amount to work with. And here you can also kind of see how it's organized. We also have allele counts. So these are essentially how many times this allele has popped up across the participant population. If you also want, you can kind of see a breakdown of information based on genetic ancestry, as well as like location, the variant type, and you can kind of go into here and get percentages to see how frequent this allele is popping up. You can also further kind of narrow down your search from all these variants. You can go to filter and sort. So if we're interested specifically in pathogenic APOL1 mutations, we can do that. We can go to ClinVar significance. So this is the significance of that mutation based on ClinVar rating. And we can choose pathogenic. So if we do that, we can apply that. And we can see there's 3 different pathogenic APOL1 mutations that are present in our participant population that have very high allele counts. And again, you can go down here, you can kind of see that breakdown of kind of what genetic ancestry these are present in. I think I maybe clicked the wrong one. Yeah, and so it's a great place to kind of go see what is available. And so now we know that we have both 3 pathogenic APOL1 mutations that are present. We have a large participant population with chronic kidney disease. So we have this data present, so we can then pursue this in our actual research or workbench, and use that row level data to start running our analysis. Another thing I would like to point out that is here that's actually very helpful is we also have our research projects directory under this Discover tab. And what this is, when it loads up, this will be able to show you all the different projects that are occurring using the All of Us research program data. So sometimes it just takes a second to load, so it'll get there. And this is a really, really helpful tool to understand like potential collaborators or who else is looking at similar things that you're interested in. So as you can see, we have over 10,000 active projects using the All of Us research data, and they're all listed here. This is a great way to kind of keep research in a positive manner, making that this is kind of all public. Everyone can look at this, and anyone that's kind of worried about stigmatizing research can then say, hey, I think that I don't like what this is looking at. I think that this is a stigmatizing research, because we really want to use this data for a positive impact on precision healthcare. So that's a really good way of kind of self-controlling that in a way. So if we're interested in looking at, hey, I wonder what other people are doing with chronic kidney disease, we can look that up and see who else is kind of exploring this. So we can see there's 10 projects that have chronic kidney disease in the title that are related to chronic kidney disease. And if we click on this, we can see kind of what are their study questions, kind of who's looking at it. So we have an undergraduate student at ASU. We don't link people's emails in here, but you give the names, the affiliations. So if you're interested in potentially setting up a collaboration with anybody, you can go in there, find them, and reach out to them as well. So it's a really great resource as well. So from here, We kind of figure out what the landscape is of what people are looking at, potential collaborators. We know that the data is within the All of Us research program. Let's jump in and actually start working with that data. So from there, we will go to the researcher workbench. And this is, as I mentioned, our cloud computing platform. For the purposes of this presentation, I'm going to be working in a specific environment called stable. This is filled with synthetic data that is not the same as our actual data set. So you will see that there will be different counts. There will be lower counts than what is actually present in our expanded and full data set. So just keep that in mind as we're going through. And the reason for this is that we want to not share participant counts less than 20, as that will kind of stay with our data and statistics dissemination policy. So just to protect participant privacy, we're using this stable kind of fake data analysis environment. So this is our home page for a researcher workbench, and this is where you'll kind of start seeing how to engage with the data and start your actual project itself. So your research projects are broken into workspaces, and the workspaces will house the actual environments and notebooks and data sets that you're going to be using for an individual project. Additionally, if you want, there are quick tour and videos at the very bottom of this homepage. So I'll cover quite a bit of things. It'll be a little fast. There is definitely a learning curve to engaging with this website and our platform. So if you need a refresher on anything, you can always go down here. There's some really easy, nice, useful videos to kind of be as a refresher to what I go over today. But the first thing that you'll want to do is you'll want to create your workspace. And this is where you will actually start filling out the kind of description that will go on that public site for the work that you're going to be doing. So you'll give your workspace a name. So let's say CKD APO L1 test, and you'll choose your data access tier. So this is where you choose between the registered tier and the controlled tier. As I mentioned previously, they all have the same data set that they're working off of, but the control tier will allow you to access more granular information such as genomic data, and keep the dates that events happened at the actual event date rather than have them shifted within 1 year. Since we're interested in working with genomic data, we'd want a controlled tier data set that has that genomic data. From here, you'll choose your billing account. What's excellent and super exciting is that all new registered researchers have $300 initial credits to just spend and explore the data. And a lot of times this will go actually very far. As long as you're not working with our genomic data or Fitbit data, which are huge and super, super hefty, chunky data sets, then a lot of times that $300 will be enough to get you through a project. But after that $300 up, you'll link your billing account. I believe that's already been covered if you've been previously, so I won't jump into that. But it is great that every new person gets, new researcher gets 300 free. From here, you will choose your research purposes. So it's educational. You'll also get what's the research purpose, everything from there. So disease focus, methods development, and then you'll kind of provide the scientific questions that you're looking at, what are the approaches that you're using, anticipate findings, how are you going to publish and express this, your results, and kind of just an overview of if you are working with any race or ethnicity groups in particular. And if you're worried about kind of making sure that what your work is doing is in the right line, it's not stigmatizing, it's making a positive impact, you can also request a review from our resource access board to make sure that it is a positive and not going to kind of get pinged for being stigmatizing in any way. For the purpose of this presentation, I'm not going to fill all of this out, but that's kind of an overview of what you would be filling out and going through. So for this presentation, I'll work off of a demo, one that I already have created. So we'll go back to our home page and we'll see that I have this intro to researcher workbench demo. So that's what we're going to be working off of. And that's essentially what I would have created in that previous slide. So we'll go here and then we'll have our landing page for an individual workspace. You'll see here that there's 3 different tabs that's kind of split into at the top so that we have our data, analysis, and about tabs. Our About tab will be exactly what we had just filled out. So going over what's the purpose of this project, what are the descriptors, and then our Data Analysis tab will house our individual notebooks where we will have our code and for specific different apps. So if we have a Jupyter notebook, then that will be for Jupyter app. If we have an RStudio notebook, that will kind of show RStudio down here, or SAS as well. But where we're really going to start is this data tab. So this data tab is where we'll start engaging with the All of Us Research program data. So we have two different really helpful tools. And we have our Cohort Builder on the left and our Dataset Builder on the right. So the purpose of these two tools are to narrow down the data that you are pulling from our enormous data set to only the data that you're interested in engaging with. So the purpose for this is essentially, this is a cost saver and it kind of makes everything more streamlined for the researcher. So rather than pulling all of the data and pulling all of that into your notebook and needing a much more powerful cloud environment and having to store all of the data, you're able to just focus on the data types that you want, and that will save you money and time as well. So the way that this is broken up is that our Cohort Builder will be able to pull specifically participant IDs. So from the entire group of the All of Us participants, this portion will help us using point and click tools, just pull out the IDs of the participant population that we're interested in. So that will probably be our chronic kidney disease population that also has genomic data available. So once we kind of get that, then we'll go to our data set builder using that cohort that we have. Then we will pull the data that we're interested in engaging with within that participant population. So if we're interested in looking specifically at demographic information or things that are related to their labs, this is where we will pull that data within the data set builder, and it will build our data set, and then we'll be able to export that into our analysis environment. So now I'll jump in, go through how to do it, and hopefully it'll kind of all start coming together and piecing together. So we'll start by collecting specifically the participants that want to engage within our project. So we'll click on our cohort builder. And this is where we get to our point and click tool interface. So we're able to start adding criteria. So as you can see, our criteria expands all of our different data types. So we have our demographic information, our survey data, our physical measurement data, Fitbit, genomic, as well as all of our different electronic health record domain data. So we have conditions, procedures, drugs, etc. So if the first thing that we want to focus on is our chronic kidney disease population, we will go to our conditions section in our electronic health records domains. And once again, we can search by using this really excellent search bar. So we can either search by SNOMED codes, ICD-9 codes, ICD-10 codes by turning that on. Or we can also just simply, as we did in the data browser before, we can type in key terms. So if we type in chronic kidney disease, we spell it correctly, we can see what pops up. So this is a similar of what we saw on the data browser, and we'll be able to click on the plus for chronic kidney disease. So we want anybody that has had chronic kidney disease in their electronic health records, and we can kind of click on the selected criteria box. If we want to apply modifiers, we can apply modifiers at this spot. If we want an age of event, number of occurrence dates, or type visit, we can apply modifiers. We don't want to apply modifiers for this purpose, so we'll save this criteria. And now it is kind of giving you an overview of that population of chronic kidney disease participants. So as what we saw before, there was something like 26,000 in the real data set. In the synthetic data set, we have 4,500. And we also kind of see a slight kind of a general breakdown of demographics based on race, ethnicity, as well as age. So if you want to just kind of like a quick overview of what your population is looking like at this portion, we also have that as well. So you can also switch this in different ways there too. So now if we have our participant population of chronic kidney disease, what other data are we going to be interested in making sure that our participant population has that we're engaging with. So since we want to also look at APOL1 and that genomic data, we'll want to make sure that this cohort also has genomic data available. So we can do that by going to group 2 and doing add. This is a Bayesian kind of formatting, so you can either do an or. So if there's another condition or another kind of signature that we're looking at, we could do chronic kidney disease or something else. But since we want this to be and, we do want to do and genomic data. So if we go to our genomics, we can choose has short read whole genome sequence data, long read, array data, structural variant data, and there's also a really nice SNP indel variant search. So if it's similar, if you want to type in APOL1, you can type that in. I was about to say, since we actually don't have full genomic data in this test environment, this is probably going to pop up here. But if you go in the real environment, it'll be very similar to the data browser that we saw before, where you'll be able to then sort and filter based on ClinVar significance, and you'll be able to see the genes and variants pop up here. So since it's not built out in this test environment, we can't really fully explore that, but it will be very similar to what we saw before. And it's a great way of specifically choosing, okay, I want the participants that have the specific mutations and variants that I'm interested in. But we can say has short read whole genome sequences. So we have 658 participants that have short read whole genome sequences within this test environment. This brings our total cohort down to 10. But again, this will be a much, much larger cohort in the actual data set. Since we have almost 250,000 people that have genomic data rather than 658. And then if we wanted to, we can continue to build out this data set or cohort. If we want to add more qualifiers, or if we want to exclude specific participants. So if we want to look at a specific demographic or a specific gender or sex, we can also do that here, where you can exclude, if you want to exclude a sex at birth, you can choose that. For the purpose of this, we're not going to do that, but you can really, really fine tune this to get exactly the participant population that you want to engage with. Once we are happy with our cohort, so we have our cohort that have both genomic short read whole genome sequences as well as chronic kidney disease in their electronic health records, we will go to create cohort, and we could do CKD test 1. We can add a description for that. So we'll just do test. We'll save this. And now we have saved our cohort. So this will then be able to populate in our data set. So now that we have kind of worked through that process of from all the participants getting specifically the participant IDs that we're interested in, we can go to our data set builder. Well, we will get the data that pertains to those participants that we want to engage with. So we'll go to our data set builder. I previously made the similar cohort before, but since we just built this, we'll choose this as our cohort rather than all participants, since we're not want to engaging with everybody. We want just our specific spot. And then from here, we will choose the specific information that we're interested in engaging with. So if we want specific demographics information, we can choose that pre-packaged concept set, and we'll be able to kind of see what data is available there. So we'll be able to see the person ID, the gender, date of birth, race, ethnicity, and sex at birth. So all of these data values are within the demographics. So if those are data points that are of interest of our research, we'll make sure that to keep those checked. If you want to bring in survey data, you can also choose that. So if there's things from the overall health survey that you're interested in engaging with, you can also click that, and you'll be able to see here that from there, you'll be able to get the person ID, the survey date time, so when the survey was taken, the questions, the answers, as well as the version name and things like that. So if we're interested in kind of also looking at like, hey, I'm also curious about how they answer specific questions on their overall health survey, let's bring that data into our data set as well. And then finally, there's a lot of different Fitbit related data that we can bring in. And then we also have our short read whole genome sequence data that we can bring in. So if we choose that, we will be exporting the VCF files. So these are the whole genome sequence VCF files for the participants that have whole genome sequences. If you choose this method using the dataset builder, you can only pull up to 5,000 participants that have whole genome sequences. There's a whole nother way to engage with genomic data as well. So if you have a cohort that's larger than 5,000, if you're looking at a very large cohort, you won't be able to use this method to pull the genomic data, but you will still be able to engage with genomic data. And you'll want to kind of look at our user support hub or working with genomic data section, and you'll be able to kind of see how that data is organized, where the buckets are, and then pull directly from those buckets once you get into your analysis environment. Additionally, we can also create our own concept sets. So these are just pre-packaged concept sets initially. So it has things that are kind of general to general data types or demographics, or surveys, Fitbit data, whole genome sequence, and then also location data. But if we wanted to get data specifically for chronic kidney disease, such as when did they first experience chronic kidney disease, what's the timing of that, we can also create concept sets. So we would click on this plus button, and once again, we have a wonderful search tool. So we can type in chronic kidney disease, and we can see the different electronic health record domains that are related. So we can do our condition, we can do our chronic kidney disease, and we can finish and review, and we can add this as a concept set. So I've already added this in as a concept set, but this is how you would essentially create one. So we're not going to create one. We're going to discard the changes. We're going to go back to data, back to our data set. We're going to choose the cohort that we just built. We will want demographic information. We'll have our overall health survey information. We'll also bring in our short read whole genome sequence data. And then if we wanted our specific information on chronic kidney disease condition, we can also click on this. And what these values will look like, it'll be under this condition section. So you'll get things like our person ID, the condition concept ID, and then like our condition start date time, our end date time. So if there's a specific time that it started, when it first appeared, and when it ended, we'll get that type of information. Visit occurrence ID. So all of these different value types that are related to specifically the condition of chronic kidney disease, this is how you would go about doing it. You can also do this for different things like labs and measurements, and you'll get the lab values, and you can really start choosing and gain that data that you want. From here, we will create our data set. So this is essentially, we are getting our data set of that cohort that we're interested in. So this is for the chronic kidney disease plus whole genome sequence participants. And it is the data that we just selected. So it will be the data on the demographics, the overall health survey, as well as chronic kidney disease information. So we'll have our NIH library data set, and it'll be CKD data. So we'll save this, and then we'll actually be able to analyze this data set. So if you click Analyze from here, we would then extract. For the purpose of this, we're going to click off of the short hold just to, oh, now I have to make another data set, sorry. So then when you export this data, you will be able to select the programming language that you want to engage with in your data set. So we support Python, R, and SAS. So SAS will be in a SAS workspace, SAS environment. Python and R. Python will be in Jupyter. R, you'll be able to choose either Jupyter Notebook or RStudio. It will default to Jupyter Notebook. So what you will actually do if you want to use RStudio is you will click on C Code Preview. And then essentially what all these data kind of point and click tools are doing is generating this SQL code. And this SQL query will actually be able to query our data set in your notebook, and then pump out the data set that you just wanted to work with. So this is our essentially our query in R. So if you wanted to work in RStudio, what you will do is you will copy all of this, or copy code. You can hit copy code. And then you will open up an RStudio environment and then paste that code into there. The default is that it will just kind of put you into a Jupyter notebook, and then you'll be able to kind of put that in. So if we wanted to work, let's just say the default in Python, we can then create a new Jupyter notebook, and we'll do this as NIH library. CKD. So then we would hit export. So what this would do is it would export it into a new environment for you to work in. Or new, actually not environment yet, but a new notebook. So as you can see now, we have this imported SQL query into a Jupyter notebook. So I want to also remind everybody and let everybody know, everything that we have done so far has cost nothing. At this stage is where the cost will start to incur. So once we actually want to work with the data, then we will boot up an environment, and you'll be able to choose that from this side panel here. So you'll be able to choose RStudio cloud environment, a SaaS cloud environment, or a Jupyter cloud environment. Since we're going to be, we pulled into a Jupyter one, this is what we'll be working with. Currently, mine is paused, so I can get that back up and running. But you will start being charged once you start an analysis environment. What's also great is that we do have kind of updates and estimates on what that cost will be while it's running, while it's paused, and then also the persistent disk. So you can also choose this persistent disk at the bottom. And how kind of big you want it as well. You can modify that. All of this is totally modifiable. If you want to work with genomic data, you will want to choose a Hail Genomics analysis environment. This will set up a Dataproc cluster environment. You'll be able to configure your workers, your CPUs, your RAM, however you want to get set up. And that will be a little bit more expensive. But if you want just not genomic environment, you're just working with electronic health records, survey data, that type of stuff, you can just work off of a recommended kind of general analysis environment. It's going to be cheaper. You can also modify this here as well. If you increase your CPUs and your RAM, it will increase how much it costs. You're just creating a more powerful environment. And your cost will really be based on how powerful your environment is, how long it's running for, as well as how much data you're pulling in and storing. So it's essentially storage costs plus active running costs is what your costs will incur. So if we wanted to, we can then kind of start this up. We would start our environment. And then once it gets up and running, we'd be able to go to edit. So it'll take a minute for it to get there. And essentially, this will be where you will go in the future session. We'll go more in depth into how to code and run things in Jupyter Notebooks or RStudio or your different app of interest. But essentially, you'll get into an environment where you'll be able to add cells. You'll be able to use, for Jupyter, you'll be able to use both normal language and coding language. And it's a great environment to work off of. So this is essentially how you will pull all of your data that you're interested in working with and get started on your journey. So that's essentially the big overview of getting to this point. And then it gets to actually being able to code and everything. But we'll go back to our homepage. If you're really interested in engaging with the data and starting a project, but you don't necessarily have the best coding experience, but you know someone that does, what's great is that we're really interested in making this a collaborative environment and really cloud platform where you can share your work with other people and collaborate. The way that you would do that, if we have our Intro to Research Workbench demo, this is our workspace that we're working off of that we want to engage with. You can just click on these three. And you can do share, and then you can find the collaborators. So as long as they are also registered users, you can type in their name or their specific ID and you can find them. So I think Danielle, should pop up, or maybe we'll try one. There we go. So Sam, who is also here, I could potentially add her as a collaborator on this workspace, and then she would also be able to gain access to that data set that we generated, to that notebook that we generated. So if she has much more coding experience than I do, and I need to bring on someone to kind of really run that code, but I want to be involved in developing and kind of gain that thought process and that research projects going, you can still kind of collaborate in that way. So it's a great way to bring in people that have different skill sets to work together to develop this. Another thing I want to point out that we'll also be going into in another section is we have a wonderful user support hub. There's definitely a learning curve to using this platform and engaging with the data, but we do have a wonderful user support hub that has a ton of information, from getting started to working with specific data types to different videos. We have office hours every week, Tuesdays for every Tuesday for registered users, every other Friday for general public, that goes over a range of different things. So if you're ever like have struggles, check out our user support hub, come to office hours, send us questions. We love to hear from everybody. You can contact us. So it's a great kind of way to really get set up. From there, I'm going to swap back over to the PowerPoint presentation. Go from the current slide. And then very finally, I do want to say this is a huge project and initiative across the entire country. And it really wouldn't be made possible without the generosity of our participants and our researchers like you to really make this move. We just want to create and make this data set for everyone to really impact and make health discoveries possible and influence precision medicine and kind of make everything better. So huge shout out to everybody that's really making that happen. And from there, we'll open it up to questions.
Great job, Michael. Thank you so much. Danielle and Sam and our colleagues at the DRC have been great in answering questions as they come in. But we did just get in a question in. It says, if I were to set up a workspace and then designate a bioinformatics collaborator to share the workspace with, I presume costs for analyses would come from my account and not theirs. Can you talk a little bit about that?
Yeah, absolutely. Yeah, you're right on. So the cost will be associated with the owner and creator of the workspace. So you can assign different roles to collaborators, and one is owner, and the owner will allow them to share the workspace as well. But whoever is the initial creator, everyone that comes into that workspace, all their work will be billed to the initial creator. If you want to also kind of have them take on the burden of some costs, you can also ask them to duplicate the workspace. And if they duplicate the workspace, then they'll be basically duplicating everything in it, but they will be the owner and creator of that duplication. So they can also kind of use their credits that way. But you are correct. Any collaborators that come in to your created workspace, it will be billed under that initial creator person.
Awesome. Thank you. Another question comes in, a very popular question that we get. Can we download the data to our own computer?
Excellent question. I did forget to mention that. No, you are not, unfortunately. So you're able to download your summary statistics and analysis, but we do have a very strong privacy policy to really be able to protect the participant information. So for that reason, we don't allow counts that are lower than 20 to be downloaded. And so that prevents people from just downloading the data set and working in their own environments. To work with this data set, you really do have to work on our cloud platform. And then once you're done with your analysis and you have your summary statistics for publication, then you'll be able to download those things as long as it complies with our data and statistics dissemination policy. Great question. Thank you for bringing that up.
Yes, great question. And attendees, please keep bringing them in the Q&A box. We'll be sure to answer them live if we can. Another question comes in. Do you have is this and other videos in the series saved somewhere? Yes, they are. We do have recordings of the previous sessions in the series available. Cindy, I'm going to call on you. Is there a way we can get those recording links out to these attendees?
Absolutely. I will duplicate everything that I've sent out from the first session and second session, along with the information from this session sometime next week.
Okay, great, thank you.
Sure.
Will C++ language become available?
That is a great question. So another thing that we're really trying to do is constantly expand our data set and our program and our tools to really allow it to be engaged by anybody and everyone that is interested in working with it. So we don't have C++ currently, but we always respond to user feedback. So please send us like a request if you can like email us, our support team, and say, hey, it would be great if you include C++, then we'll be able to really bring in that feedback and start bringing that to like our leadership and start seeing if we can get that put in as well. And that goes for anything. If there's a data type that you're like, they don't include this, but it'd be great to have that, please give us feedback. We want to grow, we want to expand, we want to make this better for everybody.
Thank you. I think we're answering questions as they come in. Another question, can you please explain the monthly charges of $4.80 in greater detail?
Yeah, that's a great question. So those charges are for the persistent disk. So this is essentially a storage device that will stay there unless you opt to delete it, which you are absolutely able to do. So there's two different storage options that you really have for storing the data. You have the persistent disk, and then you also have workspace buckets. So the persistent disk is what kind of is the natural and it will kind of save to that. But you can also direct things into the workspace buckets and then delete your persistent disk. You'll still be charged fees for storing things in a workspace bucket, but it won't be that blanket $4.8 or however you kind of have your persistent disk set up. So yeah, we have kind of an explanation of how all the storage options work on our user support hub. So if you just kind of go user support hub and type in storage costs, then you can kind of find those relevant articles and understand that. But yeah, if you don't want that persistent disk charge, then when you're deleting your environment to kind of get rid of your environment so you don't get charged for having an active environment, you can also delete your persistent disk. It really is kind of how you have your data stored and how you want to keep your data.
Thanks, Michael. I see Danielle just answered this question, but I'll raise it anyways. It says, thank you for a very informative presentation, and I want to echo that. It takes a lot of time and effort to optimize scripts in a new environment, language, and platform. Is it possible to access scripts of similar research to adapt for our own research project?
Yeah, that's a great question. So you are able to import other outside data and scripts into your researcher workbench into your data set. There are some rules essentially, as long as you're not trying to like bring in a related data set and re-identify participants and like link the participant data and other data sets. But yeah, you can bring in outside information as well. So we want to kind of, if you have things that you want to supplement and bring in, you can do that as well.
Great job, Michael. Okay, I think this should be the last question, but keep them coming, folks. Is there any discount for NIH employees? And I'll start with this. There is, it's called NIH Strides. And we presented on this last week, so we'll be sure to send that presentation link out to everybody so you can watch the recording. But Michael, do you want to talk a little bit about any other discounts available to researchers?
Yeah, that's a great question. Yeah, you mentioned NIH Strides. You can also go on our website and find for different like grants and different kind of funding opportunities you can explore there. I don't know off the top of my head, but you can always go on and see what is available and apply for those as well.
Yes, we do have a funding opportunities webpage. Thank you. Okay, I think we'll hop to the next few slides, and thanks, Sam, for putting those in the chat. But if you have any more questions, please keep them coming. We'll be sure to answer them. Are you able to click next, Michael?
Oh, sorry.
You're fine. All right. Well, hello, everyone. I've been talking, but my name is Sydney. I serve as an engagement specialist and program officer for the NIH All of Us research program. And I have just a few announcements to share with you today. So first, SAS Via, also known as SAS Studio, is a new application available within the Researcher Workbench, and it's available as of last week. So this is hot off the press. Researchers can choose to use data analysis tools, including Jupyter Notebooks, so through R or Python, RStudio, and as of last week, SAS Studio. And you can click to the next slide. Excuse me. And this announcement aligns very nicely with the next webinar in our series. This webinar today is the third in a series of 5. So some of you may have joined us for the previous 2. And if you didn't, we'll be sure to share those recordings with you. And the next webinar will be taking place same time, same place on April 26th, so next Friday. And this is going to cover tips and tricks to code efficiently within the Researcher Workbench using R and RStudio. And then the following week after that, on May 3rd, we'll go into resources to support researchers. So here we'll cover some funding opportunities, live training sessions, or different opportunities to get more involved with the program. So I encourage you to register for all of them, even if you're not able to make it. That way we can ensure you get the recording afterwards. And finally, I want to thank the NIH library staff, Michael and the DRC team here, and those on my team too who helped support the question and answers today. And before we go, I do see one more question. Are some data analysis tools more cost effective to use than others?
That's a good question. So I'm not quite sure what you mean by data analysis tools in terms of this. So what's going to really make sure that you are the most cost effective is making sure that you are only working with the data that you need to work with. So that will basically influence kind of how big of that data that you're bringing in, how big of the data that you're storing, and how intensive a machine you need to set up in order to engage with that data. So for things like if you're working with genomic data, making sure that you're limiting just to the region of interest rather than the entire whole genome sequence if you want to only focus on a specific gene or variant. So kind of thinking through how to plan and just focus on the data of interest. But in terms of tools, I like R versus Python, I don't think there's a difference that I'm aware of. Yeah, I think that hopefully answers the question. But yeah.
Thanks, Michael. I think it does. And Sam's also typing an answer, so we'll get some more information out there.
Thanks, Sam.
I also saw a question about SAS-specific trainings, and more to come soon because it's so hot off the press. I don't think there are any available trainings currently, but we do have a few user support hub articles, and I'm sure there's going to be more coming. And the best way to stay up to date with all things coming out of the program is by registering for the Research Roundup. It's a bi-monthly newsletter that the program puts out regarding all things happening in the researcher space. So I'll have Cindy share that link with you all afterwards as well. And I think we are out of time. Cindy, anything on your end before we end?
No, just to say thank you everyone for attending. Thank you all of us team for being here and sharing these great resources. And thank you to my NIH library teammates for supporting this. I love seeing all the great support online with the chat and webinar and everything. So thank you everyone and have a great weekend. I will send out the materials next week.
Sounds great. Thanks everyone.